You have described this verdict as a watershed moment, and I'm curious for people who are seeking care, for clinicians, people who work with the teen mental health crisis. What does this verdict change in practical terms? What does it allow?
It's the beginning, I mean, paraphrase Winston Churchill, it's not the beginning, it's not the end, it's not the beginning of the end, maybe it's the end of the beginning. It is, I think, the beginning of a new dialogue, kind of
Mhm.
recognizing, hopefully, that it is now irrefutable that social media has a pernicious impact on kids. I think we're seeing among clinicians, simply more and more a focus on social media. When
Yeah.
we started doing this work, there were, a lot of treaters were not asking about social media. A kid would come in with,
Mm,
mental health outcome, and it just wasn't on the list of things to ask. And, that was an issue in the KGM trial, even. The treater hadn't charted it, and they called the treater back, and the treater said, "Of course I knew it was social media," and so it was, kind of an impactful moment. But I think, treaters need to, always ask about it, always inquire about it, frequency of social media use, what platforms are being used, and, particularly, and now with respect to AI, but,
mm,
whenever one
mhm.
sees, anxiety, depression, eating disorder, suicidality, I think a very important question to ask early on is social media. The extent to which social media platforms actively promote suicide is appalling. And the addictive relationship that kids have with social media, I think from a treater standpoint, is highly problematic because, if kids are spending 7 hours a day online, that's time they're not exercising, hanging out with their friends, talking on the phone, going for a walk, doing their homework, watching TV. I mean, we used to think watching TV was,
It was so bad for us, right?
and so, we really, I think it really needs to be front and center of what anybody treating adolescents is aware of.
I love that. Love
One of our treaters is a specialist in adolescent medicine, and she says, "Yeah, we call it TikTok, Instagram anorexia. That's what we call it in the office among the practitioners." So
Yeah. Yeah. That's a very inspirational thought, and I think a good thing for anyone in this industry to be thinking about.